When we talk about cancers of the liver, the vast majority of cancers that arise in the liver are actually metastases, so a spread of a cancer where the primary site is elsewhere, but with spread to the liver. So those are difficult cases because oftentimes when tumors have already spread to the liver, the chances of cure are very challenging. And when you pair that with the fact that liver surgery is still very high-risk surgery, they become very challenging decisions to make. You can certainly do these big liver operations, remove the cancers, but then leave them with a non-functioning liver or other long-term complications. So trading one problem for another, many of these cancers are very lethal. So even when you are successful at removing them surgically, the long-term cure rates are very low. When we start doing these types of operations, obviously very important to know whether we are actually providing the benefit that we're hoping to for these patients. So the kind of research looking at population level or population-based studies has been really important. The population level studies are based on a lot of big databases that are all linked. So this type of research becomes very helpful in helping guide our decision making, right? And when we see these patients and we look at what kind of tumors they have and we compare them to our studies, then you can balance that knowledge with the risk of surgery, the patient factors and surgical factors and tumor factors, and put it all together and try to come up with the best decision for you and the patient. That has to be put into the larger context of patients' values, their expectations, and what they want to achieve in their life. And that comes from asking the right questions and doing the research and getting the answers and then deciding what you should be offering your patients. Ultimately, to do the best for your patients, you have to feel confident in your knowledge base, and that comes from study.